It is now my pleasure to introduce our keynote speaker, Tina Gandhi. Tina Gandhi has been a registered social worker for over 20 years in the areas of mental health, child welfare, and disability. She is currently working at Triad program at Surrey Place, counseling diverse families, couples, siblings, and individuals, and leading parent support groups for parents and family members of children with autism in a specialized classroom program. More recently, Tina joined a team at Redpath and provides counseling and therapy with children, youth, and families. Tina values interdisciplinary teamwork and community collaboration to support families and brings a passion for mental wellness and innovation to her work. During her keynote address, Tina will focus on accessibility and disability issues in social work and social service work practice. Tina will highlight how social workers and social service workers can take a systemic and interdisciplinary approach when working with families of children impacted by accessibility and disability issues, including families of children with autism. As a reminder, members are able to participate in a question period following the keynote address by entering their questions in the chat box on the right of your page. Please join me in welcoming Tina Gandhi.
Hello, everyone. Thank you so much for this opportunity. I really appreciate the chance to present this exciting topic. This is an area that I'm very passionate about, and I really love working with families, and especially dealing with something so difficult and so challenging, such as disability and also having to struggle with mental health. So some of the things that I wanted to talk to you about are the role that I've played at Surrey Place in terms of piloting the role of a social worker and making things more innovative and interesting in my role. So I am the only social worker on the team, and I have piloted a group, I would call it a parent support group. It's actually for any family member, whether that's siblings or anyone else, extended family. So I piloted a group that's been extremely successful, worked with families using acceptance and commitment therapy, positive adult development, as well as working very closely with families. So during the pandemic, my phone didn't stop ringing. I had families calling me at every hour. I had families calling me all the time. I was so needed in this program. So that's why we really need social work in the Triad program. So not only that, working with siblings as well as couples, because this is such a tremendous, difficult time for families. I've also worked in children's mental health for many years. So leading a lot of interdisciplinary teams. I love working with psychology, psychiatry, speech and language. Currently, I work with behavior therapists who are extremely supportive of the work that I do, as well as nursing. So we all work very collaboratively together as an interdisciplinary team. We also have family support coaches who do a lot of resource work. So we all kind of work closely to help support families, as well as research design. Research design basically is the idea around looking at pre and post measures. So working very closely with a psychologist, looking at what would help in terms of evaluating stress before and afterwards, and also promoting well-being within the agency. So I do things like Not Myself Today, which is talking about mental health for the staff. Our staff are working really hard on the front line, and they need to talk about their own well-being, making sure that as a Surrey Place mental health ambassador, people are feeling supported and understood in their mental health and mental well-being. I even ran Zumba classes for the staff and clients just to make sure that people are feeling supported and they feel positive about the work that they do. Like I said, I ran a support group that included siblings. It was open to extended families. I had moms, I had dads. It's still, there's a lot of excitement and it continues to run. In terms of the ASSIST, that's a suicide prevention training that I run, and I'm a master level trainer, which means I've run over 10 trainings. We've run, some of my social work colleagues and I have run it for high-risk communities, and we found it to be a very powerful experience. So not only for Surrey Place, but also to support high-risk communities. And we did it for free just to help communities out, because we believe in this training so much, and we believe that suicide intervention is so critical. I also work very closely with the universities to lead some of the information around disability, because we know in the MSW programs, for example, and also social service workers, you don't always get that material in your curriculum. So making sure that that comes across, talking about role plays, talking about examples. So U of T has a lot of my expertise. I also take on Laurier students, so they have that opportunity. Any knowledge sharing around this particular role, because it is a unique role, I have done that with the universities. I am always open to continuing to provide that information and be a support to our community of social workers. So people are always welcome to reach out to me at any time, because I really feel that this is important, that we have that knowledge together. And I want to share the knowledge and experience that I have. And this comes not only from technical theory, but also working directly with the family. So the words I'm going to use are directly from what the families are telling me. They are who leads me in terms of the work that I do. I listen to them, I embrace what they have to say, I hear their stories, I validate, but I also give them some strategies. But we know how challenging the role that they play has, and how we need to really truly hear what they're going through. So their voice is going to be throughout my talk today. So I just wanted to share a little bit about my journey in coming here. So the things that we're going to talk about today are some of the issues that these parents face, or siblings, as well as some tools that I use to help assess families, just some ideas. Some of it might be a review in terms of some of the social work theories that you may already know, and also talking about group work and how do we pilot that group, and what does that look like in terms of bringing families in, because they have so many challenges. The success of running a group over the pandemic is great, and it provided a lot of enthusiasm. And like I say, continue to run that group, and families absolutely, they tell me every week how much they appreciate social work, how much they appreciate the group. So we know this is an important piece for families to experience because of the isolation. I'm going to talk a lot about accessibility. How do we make things more accessible to families? And diversity. I have a very diverse group that I work with. How do we ensure that those language needs are met, and processing and all those things, as well as various treatment approaches. So the acceptance and commitment therapy, cognitive behavioral therapy, and as well as some recommendations. So like I said, being the lead, being the only one on my team, it's important that we continue to have this role working with families in terms of working with this population in children and youth. We don't have a lot of us in this field, and we need to kind of have more. And I think right from the beginning, we need to have more social workers and social service workers in this field so that we can support the families. So just things to think about are the experience of having that disability is really a shock to families. This is where we actually need our social workers and social service workers to intervene right away. You get that diagnosis and you don't know what to do. You get a lot of strategies and ideas, and you're still trying to process a lot of your emotions. So that experience over time can be very traumatic, and that's similar to, and there's research shown that is similar to veterans, right? The people who've experienced post-traumatic stress disorder. The research has shown that caregivers of children with autism experience those same symptoms as post-traumatic stress disorder. Just think about that for a minute. Wow, that is really an intense amount of stress and trauma that these families are going through every single day. We have to understand and think about that with that lens on. They also are dealing with issues like suicidal thoughts. They are depressed sometimes, they're feeling anxious, they're worried about the future, and they may be thinking about, I don't know if I can take this anymore, I don't know if I can manage, and they might have thoughts of suicide. We have to embrace and understand that those things might occur. We also know that children in the families take those different variety of roles. So a lot of times I'm working closely with siblings about taking on that parental role sometimes, and it's a lot of stress on these siblings to take on. And so sometimes extended family are taking different roles. Sometimes the dads are taking on different roles. So knowing that there's a lot of altering around families' routines and roles is something to consider working with families. There's also a lot of exclusion. They can't go out in public, right? The behaviors are so high, they can't leave the house. And so it's really, really challenging because there's just something simple as going for grocery shopping is a big deal. So knowing that you might have to deal with some exclusion, some isolation, there's a lot of sometimes cultural stigma around disability and autism. There might be a lot of looks in the community. So knowing that some of those things are really challenging. Knowing that asking for long-term placement planning, group homes, all of those things are a really difficult discussion. It's not a one-time discussion. It is a social work ongoing discussion. Again, this is something that we can do, that we're qualified to do because we know how many times we're going to have that discussion. We can't just say, oh, they didn't want respite. We want to say, tell me more about what are the reasons why it's difficult. Right now, we're in COVID. It's scary to bring someone into your home. So thinking about what are some of the fears that you have, but how can we mitigate some of those concerns? And then seeing if there's other families who've used a respite worker and felt safe, felt that they can manage the behaviors. Okay, now maybe I'm a little bit more open to the idea. So kind of helping them mitigate some of those fears is something that we can do, right? So knowing that there's some cultural issues, knowing that there are some worries about respite, discussing long-term planning, all of those things take time. Take time to process. It's not a one-time thing. This is a multiple conversation that we're qualified to have. Some things to consider. A lot of our families don't have a lot of support. When I start doing my initial assessment, I find that, okay, so where's your family? They live back home, right? They don't have people here. When's the last time you left the house? Never, right? So they don't always have those support systems in place. So having more supports for them, giving each other that support in that group gives them more feeling of, feeling more supported, feeling more understood when they can come together. Otherwise, they do feel really isolated and they don't have anyone to talk to. And so each time they're going through life, there's always a new challenge. So as they're transitioning from into the adult system, into the adolescent system, it's a more and more challenge for them to think about each time. Each school transition is a big stress. We always hear families in our program saying, I'm really worried about discharge. They're worried because they don't know what's going to happen next. They're worried is the school system going to manage the kids that have our program? There's lots of legitimate fears that we need to validate. The more transition planning time we have, the more time we can discuss it with families. I give them a wide berth. We talk about that a lot. And this is not a one-time discussion. This is a long-term discussion. We're looking at discharge. What are your thoughts? Okay, how can we help mitigate some of those fears? What are some of the things we can do, work together to help relieve some of those stressors? And again, when we're looking at the adult system, there's lots of barriers in terms of funding, in terms of not being in the school system anymore, and a whole nother system to evaluate your child and family. So it's new and it's scary. And so a lot of fears are happening when they talk about the adulthood, right? And even in group home placement, there's long-term wait lists and things like that. So things to consider. I'm not trying to scare anybody. It's just things to consider, knowing there's all these system things that you have to learn, all this new language you have to figure out, how to navigate. All of those things can be very complicated, can be really nerve-wracking for families. And again, important to just say, what is your long-term plan? Have you thought about the future? And that's usually in that assessment meeting, I'm having those discussions. I'm not saying you make a decision one way or the other, but usually they haven't even had that thought in their mind. And I see them and they're so stressed and overwhelmed and crying and, they're not sure what to do. And so helping them say, well, there are choices out there and there are ideas. Let's just figure out together what would work best for you and how you could see your future with your child and what are some of the options available. So having that discussion up front, especially with these complex, high-need families with these really complex behaviors, it's not going to be a straightforward one-time discussion. And so also thinking about other family members. Like I said, I'm working very closely with siblings. We're doing some really powerful work. They have an impact when we have these support groups. They have an impact in the role that they play, and they can provide feedback to the rest of the family, as well as grandparents, because they often take on that parenting role. So thinking about all the impact and the role of every family member is really important. Now, the last part is self-care, and it's so hard for the families. We have this discussion every week in group. Okay, so when's the last time you have some self-compassion and self-care for yourself? Never, Tina. It's really, really hard. They don't always take the time for themselves. They don't always consider their needs. Their needs are all about the child. And so thinking about, when's the last time you just even took 5 minutes for you? What would be helpful for you to just even do that? When would be a good time? It's really, really challenging. I get that. But you have to see a doctor too, just to make sure your health is okay, right? That, it's like that oxygen mask scenario, right? You have to take care of you before you can take care of your child. And it all links together. So making sure that they're okay, because we can see them in the group. We can see how tired they are. They give each other that feedback in group, saying, you look exhausted, that we want to support you, not in a negative way, but just we want to help you out. And we want you to feel that we understand that that could be really difficult. And some of these weeks are so difficult. So let's talk about what's so difficult about this week and taking care of each other, which is, again, why the power of the group. The group can say, we get it, right? I'm not going to say, I get it. I say, I hear you. I hear you. This is important. And this is really scary and really difficult for you to do on your own. So let's support each other. How can I best help you and support you? So some of the tools we use to assess families there's a variety of different tools that we can use in terms of biopsychosocial, as well as some pre and post measures and different ways I can kind of see families when I'm working with them. But I want you to just take a moment and just imagine. So whether you want to look down or close your eyes, whatever, imagine you're assessing a family and you come across this scenario. You meet a mother and she says, I just can't take it anymore. I can't manage my child's behaviors anymore. The aggression is too high. They're constantly hitting me and pulling my hair and hitting themselves. They're bleeding. It's too much. I can't take these behaviors anymore. I don't think I can keep going. I feel completely alone and overwhelmed and stressed out, and they're crying and they don't even understand what's going on. And this is a person who doesn't speak the language. So I'm using a translator to try and get all these emotions out. The husband says, I hear that stress. I don't know what I can do to help support my wife. I'm working long hours. I'm worried about losing my job because I'm also an immigrant and I'm trying to figure out what's happening with my job. And am I going to get laid off? If I take another day off my job, I might lose it. I'm sitting on edge and I don't know what to do. I need to work to support this family. I'm the sole income provider. How can I best support my wife? I don't know what to do. I know that these behaviors and all of this stress is affecting my marriage. He's also afraid of the stress is putting on him, and he might be depressed too. He admits that he could be more patient with his wife. He knows that every other day there's a layoff in his company. He worries about his job and supporting his family and how that's taken a toll on him. He says, I really need someone to talk to about all these fears and worries. He acknowledges that his wife is really stressed out. He worries about her becoming more anxious and depressed. And as I keep meeting with this type of family, the mother says, life isn't worth it anymore. I don't think I can keep going. So now I have to do a suicide intervention on top of everything else. Then on top of that, this parent has a car accident and doesn't want to leave the house, has definitely some symptoms of post-traumatic stress disorder, flashbacks, nightmares, doesn't want to leave the house. I said, look, how can I help you? What can I do to be there for you, to support you? She comes to see me. She doesn't see anybody else. She doesn't leave the house for anybody else. She wants to come see me for sessions. And we work together and we keep meeting and we keep talking about some of those thoughts and how do we frame them for some of those thoughts? How do we deal with some of those flashbacks? How do we deal with some of her suicidal thoughts to make sure she feels safe? This is my everyday. These are the type of families that I deal with all the time. This is the type of stress that they're dealing with every single day. And they're coming to you for the first time to open up all of those things. They're not going to say all of those things on the very first meeting. You're going to unfold a lot of those issues over time. So it may not be super clear in the assessment, but over time you're going to hear this information. It's all going to come out as you keep asking the questions, as you keep inquiring, as you keep being there to support these families. And in terms of some of the work, that cognitive behavioral work has been effective. Doing that suicidal work has been really effective. And also assessing what their stress measures look like before and after treatment, right? So there's all these things that get in the way or that might be really challenging, but having them leave the house to come see you is great. Going to their house is another option. Now we're in virtual. There's all these different ways to support these families. But we really have to listen for all the signs, right? We have to be there to understand all the impact on the family. So I identified goals, collaborating with the family, talking about what our goals are in terms of counseling, their coping, their stress, long-term planning. The child was 15, they hadn't even thought about what type of plan they were going to have, but they knew they couldn't do it anymore. So we activated the special needs team, which is a team that can help support long-term planning for families, look at options around group homes or in-home supports, but just starting to that process of looking at what our options are for the future. They had never had that conversation before. So imagine these families are coming to us, 12-year-old, 15-year-old, they've never had a single discussion with anybody about how they're feeling and all of these emotions until they've met with the social worker or the social service worker. Why is that? Why is it taking so long for us to come and meet with these families in high need where I'm dealing with suicide now? Because there isn't enough of us, right? So I'm addressing and I'm assessing up front, which is very, very critical. I pushed hard for that to be able to assess families up front. Otherwise, we're dealing with families in crisis. But otherwise, we're missing them in the system, is what I'm saying. We need social workers right at diagnosis. Again, long-term planning discussions with the special needs team, strategies around cognitive behavioral therapy, which is basically how your thoughts affect your feelings and behavior, to help them manage those stressors and coping strategies. Helping them discuss their marriage, which they have never done, to discuss their role and impact on each other, using that same translator who understood now their story, who had a relationship with them, who was very close to them in terms of understanding and reading what their mannerisms were, what their gestures were, what some of the language pieces are, being able to read and understand that body language and also the language piece. Really, really critical. Try your best to use that same translator to help build that rapport, because I've worked with families and they look at me and I look at them and we're like, yeah, that one is not going to work. There's no rapport. There's no understanding the language together. So working together on some of those things. Also the assist intervention. So of course, because this parent was thinking of thoughts of suicide, I had to do an assist. Very strongly recommend that we have people trained in assist. It's a very important training to have in our field because we might be doing this, and it's maybe for any population, having this training is really, really critical. Again, this is the first time this family had ever identified those thoughts and feelings, and the first time they'd ever left the house, it was to go to counseling. This is pretty powerful stuff. Talking about community connections and collaboration, so linking with some of those supports to help them reduce isolation. I also have a fabulous team that I worked with, so the behavior therapists, supervising therapist, and clinical supervisors. So people like Alex and Paul have been really, really helpful. We have a nurse. She's like this with me. We work very closely together. The nurse gets what's going on with the families as well. When I have a great schools team staff, they reach out to the families and say, how are you doing? Are you okay? Tell me about your stress, just to make sure that they're okay, even to give them some strategies at home. Fabulous, right? Okay, we're going to try the token economy at home. Things like that. It's fantastic to have a great team. Pediatrician, psychiatrist, psychologist. You need all these people to wrap your services around these families. Really, really important. as well as looking at the outcome. So the outcome, because we're very much about outcome based and what is coming out at the end, we need to do some measures. So obviously the stress measures, the pre and post measures showed that there were decreases in stress and coping. So I took note of some of the things that they were doing, but I also did these pre and post measures, which I'll be speaking about shortly, as well as no further thoughts of suicide. They said they've much reduced stress after speaking with me. The marital issues, obviously, they got to be more on the same page and speak about their issues and understood each other's roles. Mom started leaving the house quite a bit more, which was great. The child was placed in a group home with parents have full access. They can see the child as much as they want. They were very pleased with the process. They were included in everything. It was great. And now this is one of those families that's reaching out to some of my other families to talk about their experience around group home, to talk about what they went through and the importance of social work and things like that. So they're very supportive. It's nice to have some former families to come in and say, this is what I'm going through. And I want to share my experience with you. And also, this is what the group home experience is like, to talk about issues like guilt and anxiety and all of those things that you experience as a caregiver. So like I was saying, there's some pre and post measures tools. So I went through with a psychologist and figured out which is the quickest tools to help assess families up front. And then as you know, as you're trained, the biopsychosocial model is critical to work with families. And again, you're working very collaboratively with the family's input and creating goals, because you're working with them to figure out what works best for you and what you'd like to work on. Typically, the goals that I have are around coping and stress and long-term discussions. Sometimes they are about that family structure piece around the sibling roles to make sure that they're not too parentified, things like that. So as you're well aware of this biopsychosocial model, you want to see what the family or the child's dynamics look like within the family. Are they dealing with some of their own biological issues, their own issues around disability, their own history around school, their processing issues? Is the family isolated? Does the family feel supported? Usually they're very isolated. Do they have some history around school? Because often they might feel like school may or may not be supported. What are some of their family relationships? Sometimes there's some real tension with their extended family, so exploring that. Sometimes they have their own issues around anxiety and depression and coping. So exploring some of that, because they're really struggling right now. And so as much as we can do to support them, whether that's weekly sessions, whether that's daily checking in, things like that, that's what we need to do, right? They feel isolated and they need that support from us. So this is one tool called the F-COPES, and it's available. It's pretty easily available, and I can certainly share that, just to help give a kind of quick picture of what the family might look like. So we evaluate things like their social support. So we find that they're often very isolated. Their neighbors are not being very supportive because they're knocking on their door saying, why is your child so loud, right? So you don't always have that kind of community support, but maybe there's somebody within their cultural community. Maybe there's someone within the religious community that could be helpful for them, right? We need to wrap supports around families. Maybe there's some relatives that could be really, really like a brother back home. Could they be supportive? Things like that, where you can at least have someone to connect with. And of course, the group. Reframing, so helping families think differently about stressful events. Is the family connected spiritually to things? So making sure that they have some kind of connection spiritually. Maybe they can't get to the church or the temple or the mosque, but maybe they still have a connection with their religion. And then are they able to accept help and mobilize the family around some of those supports? And then also passive appraisal, which is accepting things without getting too reactive about it. So I do a quick survey with the families up front, and then one at the end of service, just to see if their stress levels have improved or not. And sometimes they do increase only because, again, that anxiety around discharge. But I've also marked throughout these qualitative measures to see other indications of success, and I keep track of those to make sure that we are understanding the first time the family goes for coffee by themselves, the first time they have dinner together. They haven't done that in 15 years. The first time in 15 years that they go and celebrate Ramadan or Diwali, right? You want to know that those things are happening for them. It's pretty exciting to hear. So this is just an example of what that tool would look like. Knowing that we have the power to solve our problems. Are we seeking assistance from other supports and agencies? Things like that. Are you getting supports from neighbors, right? just giving ideas of how families are coping. The next questionnaire is basically a questionnaire on resources and stress. So how are families navigating some of their concerns through their parents or family? How are they managing with their child? There's a score there. Are they feeling very pessimistic? Is there some physical incapacitation that they're not able to manage some of the behaviors? So that's just a quick rating scale. And again, pre and post, we can see what that looks like at the end. So here's an example of some of the questions. Our family agrees. So we know then that flags is the parents on the same page, things like that. I worry about what will happen when they, in their future, when I can no longer take care of them. All the demands sacrifice my needs sometimes, or a need of another sibling in the family. Some of my families that I'm working with have multiple special needs children. Imagine how challenging is that. I don't see them sit still ever. And so how are they managing every day, right? It's very, very challenging. Their own needs suffer at the end, and they're working day and night to meet the family's needs, right? And meet their child's needs. That's number one to them. It's beautiful to hear these stories. And caring for them puts a strain on you. So you can see those are some ways to rate some of the stressors that are happening for them. And we know children don't live in a bubble. They live in a family. They live in a system. They live in they're dealing with school board issues. They're dealing with extended family issues. They're dealing with work pressures. I just talked about that risk of layoff. I hear all the time. The risk of housing. Right now, they have their landlords trying to increase the rent. The risk of them losing they might live in a neighborhood where the neighborhood is actually supporting of the child and the child's eloping and they would help them out. And now, they might be kicked out of their house. Great. On top of everything else, now we've got the housing, we've got the work pressure. No, not too many employers are really supportive of the fact that they have to leave their work all the time to go deal with their child. They might have to leave work early, different things like that because the child's high needs. Who's going to understand that? Not always easy to manage, right? And then some of the messaging in the media, some of the messaging in society, getting that looks from the community. Sometimes the culture may not understand, right? So all of these systems, all of the laws that are out there, all of those things impact the child. And so it's not a simple one shot, ask about one thing one time and it's done. It's multiple conversations, multiple understanding of all of these systems approach and ways to think about children and families. It's not straightforward. It takes time. It takes patience. And that's why I suggest assessing families over time, treating families, giving them lots of time to work with them, to understand all of these things, understand that full picture. So why is this important? Why do we need to address some of these things? We need to engage families with diversity. We need to engage families in terms of meeting some of their needs, right? And understanding what does that look like for them. So understanding that we have that assessment process, why that is that important to them. Understanding, does our team reflect some of the families, right? In terms of diversity. Understanding what some of the families' experiences are, right? Does the family really understand a lot of the language that's being used? Because there is a lot of technical language. Keeping it as simple as possible with our language, for sure. And I've always asked families after every meeting, after every session, after every group, what more do you need? How can I help you? Do you understand everything? Is there anything you want with the goals again? To make sure that we're working very closely together. So like I said, using that language that's not too intimidating or stigmatizing. We don't need to use acronyms. We all know our terms, but the families don't need to know CBT Act systems. We just need to know how to work with the families, right? We don't need those acronyms. It's too confusing. And then the impact on the whole family, talking about the impact on the siblings, talking openly about the impact with grandparents and other family members, the dads. Don't forget the dads, right? Because I do work very closely with dads in the group, and they're important and their feedback is really critical, right? So don't forget the siblings, right? So having them as part of the group so we can hear what it's like for them and their stories. Validating a lot of those concerns, helping these families feel very, very vulnerable and really expressing their emotions, giving them that space to be able to do that. So giving yourself that time and space to have a very open and flexible assessment process. And again, using that systemic perspective, which I just demonstrated, how a family lives in those big systems, and it's not an easy process to unfold. Are we using plain language when we are thinking about accessibility? This is really, really critical. Are we using things that can help families understand some of their needs? So using plain language is really, really important. Try to understand that we have families with language issues. We have families with processing barriers. We might have families with other disabilities that we haven't thought about. One of the families is talking about concussion syndrome. So the lighting is really important. The things need to be scribed for them or given in writing, or is it verbal, or is it that closed captioning? Like all of those things to help people feel that their needs are being met with a variety of disabilities. We can't assume, so we need to ask those questions up front. How can I help best support you in terms of the language, in terms of some of these tools? Can I fill it out for you? What can be helpful to you? Again, that jargon, those acronyms, how many families say, I don't even understand what all that means. Okay, let's explain it really quickly. I don't use that kind of language, but sometimes they hear it and I'll say, okay, let's re-explain this. This term came up. SIP grant, see a claim, all those kind of technical terms in the school system. Let's break it down together. And families also explain those terms to each other. So it's kind of nice. If we need to repeat ourselves, that's okay. Again, some families have a lot of processing issues. They may need to hear information several times, right? And that's okay. That's okay. They have so many stressors on their mind, they will forget things. So if we have to text remind them about sessions, not a big deal. Doesn't bother me at all. If we have to be flexible about our times of our sessions, should be okay to do that. If we need to repeat ourselves, that should be okay. That's not a problem. Providing these questionnaires and other questionnaires that we might have in either written or verbal form. So sometimes they need to take the form home. Sometimes they need us to scribe it for them. Whatever we need to do to help support them, just offer. Offer anything we can do, whether it's a digital form, having websites in closed captioning, or a different font size, trying to be accessible as possible. Letting them take the forms home, we have to be flexible around that. I think visuals are really, really helpful. So as you can see in the presentation, I like to use a lot of visuals because I know people like that kind of slides. They like the information visually. It helps us kind of process information better when we have these sort of key points to think about. Sometimes, obviously, our kids, the kids in the autism kids like to use PECS. So anything like that helps them process that information. PECS is just a picture exchange student. Again, that idea of the pictures, right? And helping them complete any information. So again, if you need to meet families multiple times, that's totally okay. Think about those environmental barriers. So when you're looking at the building even, if you need a wheelchair to get in, maybe we need to go to a different entrance. Explaining all of those things as you enter the building. This is where you're going to park. This is where you might need to enter. This is what the room is like. Do you need different lighting? Do you need a different setting? Should I come to your house? Like asking all of those questions up front. Things like service dogs, all those things to consider. Change tables, right? Different things to consider. Do they need other interpreters? And again, let's not assume that we know exactly what language. Don't make any assumptions about that. They might be speaking Hindi, but then they might prefer a Bengali interpreter. They might be speaking Cantonese and Vietnamese. We have to kind of ask them what works best for them. But in terms of signing any consent forms, absolutely get their consent. Make sure that anything that they're signing in writing, they have that interpreter explaining everything perfectly. We don't want those misunderstandings. You don't want anything that they've signed and they don't understand. That's not good for them because they will just go ahead and sign everything. And we're like, no, do you understand what you're being, it's important. Their rights are important to us. Again, providing that support in writing or virtually in terms of what they understand what they're being asked to do, an additional explanation, understanding. Offering to scribe, checking for understanding to see if there's anything else you can do to support them. They might need multiple reminders for their needs. Again, just looking at their nonverbal cues. If we have the option of Team or Zoom, being able to read some of those cues as we're talking. Using that use of visuals is really, really helpful for families and for anybody, right? Again, offering that closed captioning, described video, for people with visual impairments, things like that. Some meeting rooms might be too bright, so you might ask them, is this lighting too bright? Would you like something a little bit better for you? Would you like something a little bit less stimulating? What would be best for you? Thinking about the noise sensitivity, thinking about the lighting, the temperature, all of those things, because sometimes people have pain issues. Sometimes people have other disabilities that we haven't, those invisible disabilities that we haven't thought about. Being cognizant of the fact that long meetings are hard sometimes. So again, if we need to meet multiple times, that's okay. Being very patient, understanding with a disability. Again, meeting location can be flexible and being just really compassionate. So note taking. I like to take notes in sessions. Again, this is a transparent process. So I'm just letting you know that I'm writing this down, especially they're telling me something about medical. Oh, something about medication. Can I write this down? Can I share this with the nurse? I'm always asking, is that okay? Of course, Tina, please do that. I've totally forgotten to ask that question, but I want to be transparent that I'm not hiding anything from you. I just want you to know this is really important. I need to write this piece down. Can I share this with the team? Yeah. And so the team's always, because I'm very vigilant, every day, the triad team knows exactly what's happening with the families. Nothing ever gets missed. So they're not missing a beat when it comes to medical. They're not missing a beat when it comes to new behaviors, things like that. The team always knows what's happening. So it's important because we have to communicate all the time. And again, knowing that just explaining, just as simple as, this is why I'm taking notes. This is why what you're saying is really important, or what you're saying might need to be communicated to someone else, just letting you know that piece. So translating services is really important. So we use a specific company. Again, I prefer to use that same translator because it builds that rapport. It allows people to open up. It gives them that comfort level with that particular person. You can ask them by name. And I know a lot of names, like I said, Mandarin, Vietnamese, Spanish, you name it, Cantonese, every request that I've heard, I've been using. So I know the people I want to ask for, and I know who the families want, and that's who I'm going to use. It makes things a lot easier for families to open up. So always use translation services when there's anything that's in writing, anything that involves consent. Use that same translator, making sure our documentation is English, or in other languages as well. Because we do know that documentation is in English. And so that is often a barrier, because I'll say to families, have you read this particular document? No, because it's in English. So how can we problem solve that? Can we meet with the translator and make sure that that's explained properly? It doesn't always happen, right? So that's why we do it, right? We have to be that advocate, and we have to make sure that families understand everything, because so much comes to us in that language. So I'm starting to see, working with some of the school boards as school council, that I've seen a couple of boards are doing things in different languages. So I'm excited that that's happening. So I'm like, we need to do more of that. That's great. That's great that we're understanding the diverse needs of all the families, and that English may not be the first language for most people. And knowing that what is informed consent? Informed consent means they understand everything that they're being told, right? Are we explaining things multiple different ways? Phone translation once is not really a decision-making point, right? Having that conversation more than once in person is how we get the consent, right? Not always asking the first time. Recognizing that you have a bias, right? So you might come in with an assumption about a certain culture. This is why sometimes it's good to have clinical supervision, just so that you can kind of run these ideas about each other, about what you're feeling, what you're experiencing, what you might be thinking that this culture might be doing, just knowing that, being aware of all of those things. And maybe you're making some judgments or assumptions about why these behaviors are occurring at home, what's keeping them happening. Well, maybe they're because they're doing this in this culture. We don't know. We don't know the reasons. We need to explore. So things like separation anxiety, people sleeping with their kids, there's reasons. Maybe they feel like, some of them have told me it's because they're checking for the breathing of their child. Their child is at really developmentally a toddler and on the baby level, so they can't communicate their needs, and this is why they have to sleep with them. Like, there might be other reasons going on that we don't think about. Just keep checking for understanding that every word is translated properly. Families will tell you their feedback. They'll give you the idea, oh, I don't know what all that acronym means. Don't use that complicated language, right? Because then they have to re-explain everything all over again. It's too confusing, right? Don't make any assumptions that we know because we're this culture. We don't know. Just ask them, how do you celebrate this particular thing? How do you perceive this event in your life? Because it might be different for everybody. So I have a couple of families of a similar culture. I can't make assumptions that they all interpret it differently. It's like, no, how do you perceive what people of this culture are? How do you perceive this event? Just asking and exploring for their own rationale and their reason, and maybe it's a little bit different. So how do we come across? Do we come across as an authoritative figure, or do we come across as partnering with our families? Is there a diverse team of staff? So again, are there needs reflected in that team that works with them? Ask how you can be most helpful for your clients. Those are the type of questions, because we know that we actually are kind of an authority figure. We have to be aware of our use of self. We have to be aware of what we're doing, because we're coming across a certain way. And so that's why I try to partner with them and be at their level and say, what do you need? Because I'm here for you. Being aware of that privilege that we have, right? Like, work together to mitigate a lot of those power differentials. And because they're the experts of the experience, we're hearing their point of view, their experiences of culture, their experience of their child. It's very, very different. Be curious, find out more, ask more questions, right? Don't assume that we know. When you're parenting a child of autism, you know everything about it. Everybody's different. I'm giving you some ideas of things to think about, but we don't have any assumptions. Some families are coping fairly well, but their needs might be different, right? And their coping skills might be different. I'm working with families with very high, severe levels of behavior. So it's very, very different, right? In terms of understanding some of their needs. When we work on goals, we work together. So whether it's dealing with something comes up and working with families and, oh my gosh, so now I have these two siblings and they're really feeling upset and they're dealing with all these behaviors and now they're getting hit and they're getting hurt. What do I do? Let's talk to them. Let's find out how they're doing. How are they coping? And maybe they're okay, but other days they're really struggling. Finding out more about that, right? So that's a goal that we can set, sibling counseling. Like I said, some families, the siblings taking on that parental filed role. So how are they coping with all of that pressure? So one of the siblings shared in the group, this is a real stress for me. I don't know if I can keep doing it like this. I need a break sometimes. I also have the pressure of university. Sharing that in group was a huge corrective emotional experience. It was so powerful because we heard the siblings saying, it's too much actually sometimes. And the whole group said, wow, we had no idea. We shouldn't be putting so much pressure on the siblings. You gave us a great perspective. Now we're going to start shifting our thinking. We're going to have to start planning for ourselves. Maybe we need to not put the pressure on the siblings. Maybe we need to think about group home placement. Maybe we need to think about other ways of long-term planning. But definitely we shouldn't be putting everything on the sibling. We just heard from you that this is really, really important. This is really challenging for you to have to manage every day. Wow. Oh my gosh. Thank you. We loved it. We embraced hearing from these siblings, hearing their perspective. And so it really shifted and it was so powerful for the group. Working with a marriage, right? A lot of couples are struggling with their roles and some of the dads are trying to figure out what's going on. Some of them are separated. Some of the moms are struggling, trying to pull in different supports and they're feeling overwhelmed. It could be a variety of different things. We don't assume male and female roles. We don't know. It might even be different types of families. We have to also check our assumptions around that, right? So knowing that within a couple, it could be a variety of different couples, it could be a variety of different experiences. What are some of the conflicts that they're dealing with? The co-parenting could be really challenging, right? Because then there's the other siblings they have to deal with. What if they're all special needs? How do we manage all of those issues? Who takes on some of those roles? The impact on the entire family, the impact on the extended family. The idea around long-term planning, that could be really challenging. Some of the parents have their own other mental health history. I've been seeing a psychiatrist for such and such, but now that I'm seeing you, yeah, right? So they had totally neglected their own mental health needs until they come to speak with you. How are they managing with their coping and stress? How are they managing in terms of engaging with community? Have they even thought about funding and resources, right? That might be a role for someone else, but it's important that they're aware that there are supports out there. And then also dealing with the culture and language piece. Like I said, you may not know until as you meet with families, until you hear from both family members, everybody involved, and using that translator, we can't assume that we know. All of a sudden, a whole bunch of more issues come out as we're listening and hearing and having that language to help those translators to help families open up about what's going on. Why do we need the group? Groups are really important because they help families feel more connected. Families have been extremely isolated over the pandemic. They begged me, let's have a group, Tina. Let's do something where we're connected. So we had that kind of bringing together of families in the group format virtually And it really helped them connect with each other. It helped them talk about those anxiety, the guilt, all those feelings in terms of placing their child. What was that like? What are some of the other options of having some workers and some funding that could help support their child at home? That's another option with that system. Meeting other families of diverse cultural backgrounds, really exciting to have that. And then they shared some resources, information that were helpful for them, right? I really like this Believe program, for example. There's different programs in the community. So recommending that to other families just opened up a whole new world, because that particular program has transportation and different things, right? So other families hearing about that was like, wow, this is great. Thank you. This is a perfect resource for my child's needs. And you get that sometimes it's difficult to get there. So having that shared resource and information and knowing that there's respite workers that can actually manage their child's needs, amazing to hear. They share that with each other, and it's a really open discussion. So as we know, families are dealing with no community, no family, no social supports. They haven't left the house in all these years. They need that sense of connection. The other thing they feel is guilt. If they have to take care of themselves, it's a feeling of guilt. If they have to look at long-term planning or group home placement, it's guilt. What am I going to do with the future? I haven't even thought about that. So all of those feelings around future planning are very, very challenging. I spend almost a year sometimes working with families just talking about future planning. There's no like black and white discussion around this. It's not a one-time thing. Understanding the adult system, some of those supports get lost, right? They don't always get that same level of funding and support. They don't always get a group home placement right away. It takes time, right? And so no one really understands their process. How do they ensure that their needs are taken care of in the midst of their child's needs? Are they even getting their doctor's appointments? Things like that. Seeing other families experiencing respite and future options is great. Advocacy within the school system and their physical health needs. So things like that, they can use their own terminology, and also addressing some of their own needs when they haven't been. So for physical health, things like suicidal thoughts, depression, anxiety, having nervous breakdowns sometimes, diabetes, sleep apnea, like I said, their hair falling out, high cholesterol levels, depression, high blood pressure, tiredness, weight issues, dizziness, inability to concentrate. All those things are things that are impacting their own well-being. Lack of sleep, they don't sleep at all. Stressors, I just talked about the job, finances, strain on the family, the neighbors being stressful sometimes, a lack of support from others, no time for the couple for sure. They're always exhausted, they're not communicating, and they're dealing with ongoing crisis and sometimes that trauma impact on the families, as well as never having a break and worrying about new people coming into the home. So some of the other factors that we're dealing with are the installation of hope. So having them kind of seeing their future, thinking about having that same experience, modeling some of the respite, having a sense of belonging, the first time them ever being able to kind of get those emotions out are really, really critical for them. So there's some research, right? Yalom does a lot of great research and group work to talk about that. So like I said, long-term planning, using mindfulness, things like that are really, really helpful to them in terms of systems and structural interventions, things like that, and long-term planning and identifying some of their cultural needs. This is a thought record for helping people with their thoughts and help from their thoughts that affects their feelings and behavior. This is one of the tools that they can use. So this is just a visual to help them understand some of their feelings and thoughts. This is an acceptance and commitment therapy tool around helping them move towards the things that have value in their life. And it's called a matrix. And so this gives them a visual way to kind of move to things that help them and support them and what actions they can take for themselves. So these are just some of the treatment tools that help families understand. So this is just what that visual looks like. The bullseye is another visual representation of how families can move towards the things that are important in their life, like working towards their closer relationships, maybe working towards education or time for themselves or their own health. So we know that there's a lot of great evidence-based research. Parental stress, there's lots of articles. Biopsychosocial is well known, as well as CBT and ACT. So there's lots of great research on that. So there's an article talking about CBT, and here's another one on ACT, just showing that these are effective treatment models for families. So what I'd like to see, these are the visions of things that I'd like to see, is having families diagnosed and having a social worker or social service worker upfront, understanding that sibling and family impact and the grief and loss that they have right at diagnosis, as well as that cultural impact. Having things like parent support groups and or other support groups to have for families that can be very effective, even virtually. So this is for families of elementary and transition years, for families, that key role in sibling, family, and couple counseling, the key role for social workers and social service workers to talk about long-term planning. Very important. Working collaboratively with service coordinators, family support coaches, anybody in the community to support families to help that planning process go well. Some of my service coordinators are, in fact, social worker trained, so that's good to know. And so they can understand things like the PTSD, post-traumatic stress disorder, and crisis needs that are really high and that they're not sleeping well. Having services wrap around families, so they're very isolated, helping them navigate the system, helping them use some of the language that they need to know, and working very closely with racialized families and how that, not using the word counseling, saying we're here talking about stress and coping will help them. Talking to them about the critical need for a break, so respite, as well as knowing that we are dealing with suicide and trauma often, and that's really difficult. Systems adequacy, so we talk to them about their grief and loss, working with some of those systems together with the rest of the team to talk about those complex high-need families in the future and mapping out their vision of the future and helping them provide advocacy to have some more transfers to other agencies to reduce some of the barriers. Now, again, there's not a lot of social workers to transfer the cases to, but maybe there's some other systems that we can help support families to help them articulate their needs. Helping them with transition planning, so helping them with their own capacity in terms of long-term and grief, as well as recognizing their own needs and discussing the wait lists that are happening in the adult system. It's very challenging, and helping them talk about registering for DSO and things like that, Developmental Services Ontario, because it's difficult. And there's other programs like young adult programs and things like that that Surrey Place can help with some of the families in those in-between years. So again, knowing that families are very heightened when you first meet with them, understanding that level of stress. They're going to need a lot of information. There's going to need to be repeated a few times. We might need multiple discussions. Be aware of yourself and your privilege. Be flexible with the assessment process. Ensure that consent. Be flexible on your meeting location and normalize the impact of the family. So understand and be sensitive to some of those needs. Not using a lot of acronyms is really helpful to engage families. Use of that translator. These are just the key takeaways that I want everyone to have. Having those reminders of the sessions is very helpful. And that sometimes a lot of information at once can be very overwhelming. So a lot of emails, a lot of things can be very, very overwhelming to them. So having them support them on what exactly do you need to negotiate what would be helpful for you. So those are the key points that I wanted to make in this talk. Thank you so much.
Wow, so much information. Thank you very much, Tina, for providing such an insightful and relevant presentation. Obviously, very passionate about this work. And like me, I'm sure that all of us found this information very valuable. As I mentioned previously, members are able to participate in question period by entering their questions into the chat box on the right of the page. In order to accommodate questions for as many members as possible, we'll ask that you limit your question to one at this point. I would now like to ask Sarah Chowdhury, the college's Director of Communications, to read some of the questions.
Thank you, Mukesh, and thank you, Tina. We've had a lot of engagement throughout your presentation today and a lot of really positive comments. So I'm inviting anybody who has any questions that they can just add it into the chat feature, and we'll take a few questions right now. I'll maybe read out some of the positive comments that we received. So very important and pressing topic to be discussed at today's forum. Tina, Gandhi is so relatable. Thank you for sharing your experiences with us. Another comment, this is such an informative presentation that is applicable to other populations and service areas. Tina is an engaging presenter. Thank you. I'm also getting questions wondering if the PowerPoint presentation slide is available. So just a reminder, if you scroll down from where you're watching today's live stream, there's a subheading called description. Right under there, we've shared Tina's PowerPoint presentation. So it is available on the screen where you're watching today's live stream. You just have to scroll down a little bit to be able to find it. We have another positive comment. Very good presentation with many valid points. Glad to see so much progress in the area of social work and social service work. So we have a question from Harpreet. Tina, what are your thoughts about families who think they can take the child back home because the system here will make them more disabled?
System would make them more disabled. Sometimes some families do want to take their children back home. I think referring to back home as in their home country. It's challenging. I think it's a debate for them to figure out. And again, we work through, here are the supports in Toronto. So even sometimes moving like into another region, you don't get the level of support in Toronto, right? But talking to them about the pros and the cons, about if back home, do they feel like they can manage better? If they feel like they would have the level of support, then that's up to them. Knowing that here we have that kind of great multidisciplinary team that could help support their needs. Again, decision's theirs. I'm not going to make a judgment call, but I want families to know here's the pros and cons for them to help them decide, and here are the level of supports that you would be able to get within this region. So Peel region, I work with families in Peel region, Toronto region, York region. So I'm all over the place talking about those level of support. So just helping them understand and navigate.
Thanks, Tina. There's also a question, I'm not sure if you're able to answer it, wondering where members might be able to receive suicide training that you mentioned.
To the assist training, yeah. So typically I would run it through Surrey Place, but I have a group of social workers, some of them who are here, Marcy Gray, for example, we run it sometimes externally. So we're happy to run it for populations, absolutely happy to help support the community in any way. Sometimes they are available locally. Right now, it's because of COVID, it's been really tricky to do it in person. But we are looking at the new year, for example, within Surrey Place, we're looking at running in some internal ones with small groups. Always happy to run that kind of training. I think it's so critical. And then because the group I run with is in the field, we add our social work spin to it and how valuable it is with the families. And so we're very passionate about running this training.
Thanks, Tina. There's a question from Melissa asking, do you work with the children directly or is it always a family approach?
So in this particular situation, I do work with the families and the siblings only because the level of behavior of the children in triad are very high level behavior. They're not verbal. So it's a little bit tricky for me to do a lot of the interventions, but I have worked in previous agencies with children directly on suicide, on anxiety, depression, all those type of things. I have had that experience working directly with children. It's just this particular role, it's just because of this population. It has nothing to do with not wanting to. It's just, it's tricky to do that kind of therapy with them directly. There are, like I said, that behavioral team is working directly with the children. There are speech therapists. There's a whole bunch of team members that are working directly with the child.
We have a lot of questions coming through, so we likely won't be able to get to all of them. But I think Tina will, we can maybe make sure that she's connected online after today's forum. So I'll maybe just take one last question. Sure. A question from Ursula. Any ideas on how to approach a parent that is in denial of their child's needs? Absolutely.
So again, finding out what their story is and finding out what their narrative is around some of their child's needs, because we know it may, and I still see families and they're like, there's going to be a cure and they're going to get fixed. And it's like, no, there's not one miracle cure. Sometimes having that medical team working with us together, the psychiatrist or the nurse, we meet together to talk about this is their needs. This is what we see that would be helpful. That sometimes perspective is really helpful. Like I'm a huge collaborator, so I like to work with the team in terms of giving that feedback. But if the family is super resistant, then we just kind of don't push that, right? We know where there's going to be a trigger point where they're going to hit a system where it's going to be really challenging, and then they're going to have to work with us. But we have to respect that if they're really in full denial, it's going to be tough to kind of get them to work. But like I say, I keep my first meeting, we talk specifically about coping and stress. How are you coping? How are you managing? And then we'll see, right? And sometimes we just have to let the issues unfold. We can't force a family to really accept things when they are not there yet.
Thank you, Tina. So I think that's all the questions we're going to take now, but Tina will be hopping online after the forum at some point today to be able to respond to any unanswered questions. And just a reminder, her PowerPoint presentation is available on the screen that you're watching today's live stream. So just scroll down under the description section. You'll be able to click on her keynote PowerPoint presentation.
Thank you again, Tina, for today's keynote address. Please accept this token of appreciation on behalf of the college. To all the attendees, thank you for participating today. I hope this year's educational forum met and perhaps exceeded your expectations, and that we were able to reach a wider audience while supporting and educating our members. As a reminder, following today's event, you will receive an email with a link to a post-event feedback survey. We encourage you to complete the survey, at which point you'll have access to a link to a certificate of participation, which you can fill out and print for your records. I again thank you for your participation today. Have a wonderful day.